What hidden neurological pathways do OTS help with autism motor skills? Imagine your brain as a busy city with many roads connecting different neighborhoods. Some of these roads are well lit and easy to travel, while others are less obvious but just as important. Occupational therapists focus on these less visible pathways to help improve motor skills in autistic individuals. These pathways are involved in how we move, balance, and process sensory information. They are like the hidden routes that keep the city running smoothly. When these routes are not working well, it can cause challenges with coordination, balance, or even everyday tasks like dressing or writing. OTS understand that the brain can change and grow, a concept called neuroplasticity. This means they can help strengthen or reroute these pathways to support better movement and sensory responses. Research has shown that certain parts of the brain, like the mid-cingulum, corpus callosum, and the left middle cerebellar peduncle, often work differently in autistic people. These areas connect different parts of the brain that handle movement, sensory input, and emotions. When these connections are not as strong or efficient, it can affect how well someone coordinates their movements or maintains balance. Sensory integration is another key piece. It is how the brain organizes information from the senses like touch, sound, and sight. If this process is disrupted, it can make motor planning and execution more difficult. Occupational therapists use a variety of strategies to target these pathways. They might use sensory integration therapy, which involves activities that help the brain better process sensory input. Repetitive motor tasks are also common, where practicing specific movements helps strengthen the neural circuits involved. Neurofeedback and biofeedback are techniques that give real-time feedback about brain activity, helping individuals learn to control their focus, calmness, or movement. Structured routines and visual supports create predictable environments that reduce anxiety and help the brain focus on learning new skills. Play-based activities and functional tasks like climbing, swinging, or manipulating small objects are also used to stimulate these pathways in a natural, engaging way. In therapy, occupational therapists start with a detailed assessment of each person's strengths and challenges. They set personalized goals like improving handwriting, dressing, or participating in sports. Activities are chosen to target specific motor skills and sensory processing needs. For example, a child might work on balancing exercises or practice using utensils during mealtime. The therapist also works with families to incorporate these strategies into daily routines, such as creating sensory-friendly spaces at home or using visual schedules to help with transitions. All of these efforts aim to support the brain's ability to adapt and improve motor skills by strengthening the hidden pathways involved. Through consistent practice and targeted activities, occupational therapists help autistic individuals become more confident and independent in their daily lives. This approach is rooted in the science of neuroplasticity and tailored to each person's unique needs, helping them move better, feel more comfortable, and participate more fully in everyday activities.